Okay, welcome back. We are now going to be talking about the definition of body mechanics, the benefits of using good body mechanics, and some of those causes of back injuries that we see commonly. The definition of body mechanics is going to be the use of one's body to produce motion that is safe, energy conserving, and anatomically and physiologically efficient, and that leads to the maintenance of a person's body balance and control. So basically what that means is we are trying to lift or use our body's motions and strength, avoiding injury and preserving our energy. And we can do that safely and efficiently simply by positioning ourselves in a manner in which we are setting ourselves up for improved motion. So positioning the item or the person that we're moving, positioning ourselves in a certain way, knowing the best way to have our selves prepared and ready for a lift. Now, the benefits of proper body mechanics are going to be, we're going to conserve energy. We don't want to overuse ourselves, especially when we spend 8 to 12 hours working with our patients each day. So if we can conserve energy, we can certainly last a little bit longer. We want to reduce stress and strain to muscles, joints, ligaments, and soft tissue. So one of the things that we see often that is often due to the lack of not using proper body mechanics, it's due to not using proper body mechanics. We do see those stress injuries and strain injuries. So, and most often they are low back. And unfortunately, once a healthcare provider has injured their low back, that continues to be an issue for them as they progress throughout their career. Body mechanics, using proper body mechanics can also promote effective, efficient respiratory and cardiopulmonary function. So just simply, again, our positioning, being able to be upright, sitting, standing, we're improving our internal organs, okay? Promoting and maintaining proper body control and balance. So again, positioning in the best way that we can to promote our own proper balance and control. And that's going to eliminate injuries for us. Could be eliminating a fall for us. It will also promote effective, efficient, and safe movements. So when we use our proper body mechanics, we're making ourselves much safer, and by making ourselves safer, we're making our movements safer for our patients as well. Generally, the cause of back injuries are going to be increased force or stress. So if we lift improperly, we're going to get some additional force or stress on those soft tissue muscles, ligaments, repetitive motion such as twisting. So if we twist improperly, especially if we've got an additional force on us, so while we're transferring a patient, we can see some back injuries doing that. Forward bending, and this tends to be one where we see a lot of injuries. Folks try to bend over and then lift, so then they're using their back muscles to lift, and that's never a good idea for us. Poor or improper lifting techniques leads to back injuries, okay, that makes a lot of sense. Poor posture, so if we're sitting in a poor postural position, that kind of closes up our internal organs. So our cardiopulmonary, all of that stuff kind of collapses, and it's just not working at the most efficient manner, in which it can. Poor job design, and now that's going to go a little bit with ergonomics. I apologize, my computer went to sleep. But poor job design is going to go more with ergonomics, but it can also be attributed to our body mechanics. And then another cause of back injury can be deconditioned or poor physical fitness. So if we don't have those good strong muscles going on, we may be more predisposed to a back injury. Some other causes of back injuries can be simply being overweight, smoking, poor nutrition, or even stress can cause that. So generally, poor posture is one of the main reasons that injuries do occur. Okay, so just simply being in a forward slump posture or any kind of a posture that really puts us at risk for any kind of injury. So that means that our spine's normal curves are exaggerated or decreased, just depending on which area of the spine we're talking about, because certain curves have, you're going to have those concave and the convex curves of our spine. Those are very important to keep in alignment. When those curves are exaggerated or decreased, it can create stress and strains on the tissue. So that puts us at the likelihood of a back injury. Again, that it leads to pain and dysfunction, and it can at times lead to serious injury. If we are lifting with a forward bend, it overstretches the low back muscles to the point where they can lose strength and then they're not able to protect the spine from injury. Okay, so if we're continually lifting with that forward bend, we're stretching out those ligaments. And you can think of a ligament as similar to a rubber band. You can pull it out so far, and then it will continually go back to its original size. But if you go past that certain point, it's going to stay stretched out, and so you are losing that elasticity. And it's similar to what happens with our ligaments. Okay, when we forward bend, we also increase the stress on the discs in our spine. Okay, which can cause a lot of pain, especially as we progress in age. The range of the bend and the time spent in that position can also determine the amount or the extent of the damage. Twisting is also a huge problem as far as body mechanics are concerned. Repetitive twisting can and does do damage to the spine, especially if you are having an external force such as transferring a patient, taking them from, say, a wheelchair to a bed or a wheelchair to a shower chair. Okay, this also puts us at risk for damaging our discs, especially when you combine that with that forward bending. We will talk more about ergonomics in a next lecture, but that also kind of really sets us up for the potential for those strain and repetitive motion injuries. Poor physical fitness, so if we have decreased oxygen delivery to muscles, that can cause muscles to wear down and lead to weakness. When we have that weakness, we're set up for injury. One thing to remember is that in order to have a strong back, we need to have strong abs. Okay, so strengthening our abdominal muscles as well as our back muscles. Those trunk core musculature work together in order to prevent injury to the back. So it's important not just to have those strong back muscles, but also to have those strong abdominal muscles. Being overweight and smoking can also lead to injuries of the spine because it's creating extra work on the spine. Being overweight or smoking, it's possible that we are extra tired, and therefore there's more wear and tear on the body as well. Nicotine also damages the connective tissue, decreasing circulation and oxygen in the blood, which does affect the muscle strength because our muscle fibers require oxygen from our circulating blood in order to maintain their strength. Nutrition and stress, we need protein for our muscles to get strong and stay strong. Bones need minerals for strength, so if we're not eating a good nutritious diet that's balanced, our bones are not getting the minerals that they need. Stress can stiffen and weaken back muscles and also increase pain and sensitivity. When we start talking about some proper lifting techniques, and this will be demonstrated for you in an additional video, we always stand with our feet 1 foot slightly in front of the other, and you also want to have a wide stance to help with balance. So the wider your stance, and generally we say shoulder width or a little bit wider, that gives you a larger base of support, which really gives you a good solid base in which to make your lifts, okay? Once you've gotten your feet 1 foot slightly in front of the other, your feet are shoulder width or a little bit wider apart, then you're going to squat down, making sure that you keep your back nice and straight, your chin is tucked, and you're going to lift smoothly, okay? So you don't want any of that jerking motion. You always want to keep the object close to you. If you hold something as light as, say, a full water bottle in front of you with your arm fully outreached, it doesn't take long before that water bottle starts to feel very heavy. However, if you hold it close to your body, it doesn't feel like you're lifting much. So the same idea comes into effect when you're lifting a patient or a heavy box or some sort of heavy piece of equipment, okay? And then you'll want to bend your knees and hips, and you always use your legs to lift. Never use your back to lift. That's where you're really setting yourself up for injury, especially at the back, okay? You always want to maintain your lumbar curve. Your lumbar curve is your lower back curve. You don't want to twist or bend sideways, and you always want to face the object that you're picking up. So face it head on so that you're not coming at it at a twisting motion. If you do need to change direction, you don't twist, you simply pivot your feet, okay? If you must reach over shoulder level, you want to raise onto a low step to get closer to the object. So if you can get a small step stool to get yourself closer to the object versus trying to reach on your tiptoes or, stepping outside of that comfort where it's not close to you. You always want to push rather than pull. Pushing is much easier on the body. Pulling adds additional stress and strain. You want to stabilize objects. Keep your hands on an object to keep it stabilized. And take your time. There's a lot of meaning to that old adage, haste makes waste, and this is one of those things. So always take your time. Prevention's going to be key. Make sure you prepare for your job. And again, we will talk about this a little bit more in another video. So I do hope you'll join me and we will continue.